one of the things that we hold dear at Frontier is our culture of caring. And what that means to us is that we care about one another as a faculty and staff. We are professional and we are respectful of one another. And I'm going to show you this. I don't know how well you're going to see it, but I'm going to show you a little button. There it is. Yeah, I can't see it very good. I apologize. A little button that reminds us all the time, and I keep it here at my desk to remind me of the values that we hold dear: professionalism, respect, positive communication, mutual support, and inclusivity. We talked together years ago about that, what matters to us. And those are the things that we identified as mattering greatly to us. And so we try to strive and do that. And so we create this culture of caring with you and about you and for you and for ourselves. As I said, Dr. Eva Freed is not here. She's the clinical director, and that's a job I have done in the past as well. And so I know about clinical. Some things have changed, but I've tried to keep up with the changes so that I can answer any questions that you have. And I work within the midwifery and women's health department. I am a certified nurse midwife and a women's healthcare nurse practitioner. I've been a midwife for about 25 years and a women's health nurse practitioner, I don't know, somewhere around 20 years. So I hope that you've looked at our mission. I'm not going to read to you today, but I hope that you can see this and identify the important words. So the important words to me would be competent, entrepreneurial, ethical, compassionate. And we looking at all people and focusing especially on rural and underserved communities. So underserved does not always mean rural. We know that. We know that there's some places that have that are inner city that are underserved, that live in large suburban areas that are underserved. And I'll give you a little secret. We think if there's not midwifery care or adequate midwifery care where you are, so that women have choices, then we feel like you're underserved, even if you don't check that box from a legal perspective. So we have a distance education program. And what that means to us is that it's not just that you're working in your home, but you're working within the confines of your community, so that because you know your community best, you know what your community needs. You have relationships there that will help to further your success in a program like ours. We use this community of caring that we've talked about just a second ago. We use your community and our community, meaning our Frontier community, as your classroom. You can study from the confines or from the comfort of your own home. We ask you to come to campus twice, and we ask you to come as an orientation time, and then at the end of your book work or didactic time, you come back to campus for 5 days to learn the basics of some hand skills that help equip you to go into your clinical setting. So our program is set up with the book stuff first, and then the clinical stuff, the actual going to clinical, in the second part of your program after you've come back to campus. We have a lot of years of experience in graduate nursing, and especially in nurse midwifery and nurse practitioner education. We have students and alumni from every state in the United States. We currently have 2,500 plus students enrolled and over 10,000 graduates from our program, and they're working all over the place. And that picture from commencement, I just want to tell you, it's our favorite day of the year when we get to all get together and watch and witness the success of students that just like you. So here are a few of our achievements. We're very proud of our achievements in the area of looking after our faculty. So being a good place to work, because, you know, if we're happy, you're happy. It's kind of like, you know, at home, as well as our commitment to inclusivity and to diversity and equity. And so you can see that we have also had concentrated achievements in those areas. So we hope and pray that we're a commitment to you. We commit to taking care of you in our culture of caring, to working alongside you, to having a good place to work and a good place to learn. Now, we've accomplished this by setting up around you a strong team We really believe in a team approach because it takes a village, right? It takes a village to accomplish things. And when we all work together, we achieve bigger and better things. So here are some of the support services that we have for you. We have faculty members that live in certain regions of the country that are called regional clinical faculty, as well as preceptors in all different areas of the country that are equipped to help you. And we hope that you bring us preceptors as well. You know your community better than we do. So there may be the best nurse practitioner or the best nurse midwife in your community that has never partnered with us. We want to partner with them too. We want to partner with you and your community to help achieve a strong educational process for you. We have trained academic and clinical advisors. So the academic advisors kind of help you a lot on the front end as you do that didactic or book work that we talked about. And then on the end of clinical and preparing for clinical, we have clinical advisors that help you to figure out, how do I search for a great clinical preceptor? Where do I look to do that? What matters? How do I create a good resume that will help to get the preceptor, the kind of preceptor that I want? We have online student mentoring groups. We offer lots of financial aid and scholarships. In fact, just yesterday, I was reviewing some scholarship applications. We do that twice a year. We have online library services, and I'll tell you, when students come to Frontier Bound, that's the orientation time, one of the most popular sessions, take a deep breath, you're not going to believe me, is the library session. Because like most people are like, wah, 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 that won't be fun. Trust me, it is one of our most popular sessions of our in-person bound. So Frontier bound to come to Frontier, and clinical bound to go to clinical, is our library session, because they do such a great job of equipping you to be able to do the things that you need in your courses, and they're available all the time. And then special student interest groups for different needs that you might have, or you might identify with certain types of students. That gives you a smaller group of people that you can come to know and that can support you in your journey. As I said, I just finished reviewing some scholarship applications. They're offered twice a year, in the spring term and the fall term. And by the way, we go to school all year, so we have 4 academic terms, but fall and spring are our award terms. And you must have accomplished some of your journey already before you qualify for those scholarships. And the reason is, we want to see that you're moving along. We want the scholarships to go to students who have a record of success and who are moving into the next sections. And clinical tends to be a time, so you're moving toward clinical at that point, tends to be a time that feels more expensive to students, because you may need to take time off for work, or you may need to take a leave to accomplish your clinical time. So to help supplement that, those are the times we offer all year, but those are the reasons that we ask that you have some of your program already completed. You demonstrate your success with your GPA. The amounts and the number of scholarships vary from term to term. But did you see that number? Let me back up there. In 2024, we awarded right at $1.7 million in student scholarships. That's because we believe in you. We want you to be successful. And sometimes that means financial support. We have clinical outreach and placement. That is one of the biggest student supports that we offer. And what that means is that we have a team that is familiar with the way to help you to get ready to go to clinical. We provide assistance and resources in locating clinical sites and preceptors, as well as working with you if you know somebody that you think would be a good preceptor. We work one-on-one with you to accomplish that. We know that your situation is potentially unique and it is special to you, and we want to provide special service for that. And we also want to support your preceptors. And so the clinical support, outreach, and placement team helps with that from that perspective. Now, this is just a little bit of the leadership, or the people that you're going to see at Frontier. Dr. Eileen Thrower is the chair of the department. That means she's in charge of the faculty and and the curriculum for midwifery and for women's health. Dr. Eva Freed is the clinical director, so she works specifically and focuses on your clinical time, the curriculum during clinical, and how to support you in clinical. Course coordinators and course faculty are available and lead the coursework itself. And then regional clinical faculty, I mentioned before, those are faculty members that are your direct support people while you're in clinical. You also kind of talk with them along the way as you prepare to go, but once you're in clinical, they are your go-to person. You meet with them regularly, they talk with you, they talk with your faculty, with your preceptors, they visit sites and talk with you and figure out how things are going and guide and lead you through that exciting time during clinical. You're going to have an academic and a clinical advisor, as we talked about. You're going to have a financial aid officer that is assigned to you and a credentialing coordinator who helps to make sure that your paperwork and all the things that you need to do, like the boxes that need to be checked to be able to place you into your clinical site, are ready. So this is a team. It is let me just tell you right down there, you probably can't see I don't think you can see my cursor, but down, if you look on the bottom left, first left there, the bottom left, that is IT. The IT folks here are phenomenal. They are available to you almost 24 hours a day, and they make you feel like you're bright about technology even when you're not. This is from experience, and they help guide you. And then we've got people there from credentialing, from clinical placement services. We've got one of the librarians there. And then the top right is Eileen Thrower. That's your department chair. And directly below her is Eva Freed, the clinical director. All of our faculty members are doctorally prepared and work within the specialty that you are working on. Like if you choose to be a nurse midwife or a women's healthcare nurse practitioner, they are equipped within the content area that you are working in. I don't know about you, but this even speaks to my week. Boy, I set out a plan, and plans are important because if you don't have a plan, you're kind of planning to fail. But along the way, life happens, right? Sometimes most of the time, it doesn't go just like you went, just like you planned. However, look, you still end up in the same place. And in those valleys or those bumps along the way that don't go exactly like you expected, this team is going to surround you and help you to figure out what your best next steps would be. We have the following degree options. You can get a master's degree, you can get a postgraduate certificate, and I'm going to go through what qualifies you to seek a postgraduate certificate. You can get a doctoral degree. There are the time frame options. As I mentioned, we go on a term system. It is kind of, if you look on the calendar, it looks like a quarter system, but we have semester hours. So all of the credit hours are granted as semester hours within basically a quarter system. So we have 11-week terms, then you have a 2-week break, and then you start another 11-week terms. The MSN, if you're doing the MSN, it takes 2 to 3 years. The postgraduate takes about a year to a year and a half, and the additional doctorate after you have completed a master's takes about 18 months. Here are some of the admissions criteria for a student seeking a master's degree. You have to have an RN with a current active license, a bachelor's degree in any field, so it doesn't have to be a BSN. You might have a nursing degree, you might have an ADN, and so you're a registered nurse, but you may have a bachelor's degree in another field. However, the grade point average that we're looking at is in your most recent completed nursing degree. You must have been in good academic standing, have at least a year of nursing experience, and we do have some limitations in the upstate New York area. We can only place 6 students in the clinical, in that area in clinical, in that geographic area in clinical. So that means we limit the admissions so that we don't flood that area and then have students unable to get clinical sites. That's not true. Every other state we're pretty open in. That doesn't mean it might be hard, but we are open in all the other states. If you're going to be a postgraduate student, same thing. You have to have an RN. You have to have an active license. You have to have a master's or higher degree. And same thing with the clinical limitations in upstate New York. One additional thing, if you have a master's degree in nursing, and let's say it's in education, for our purposes, it does not count as a postgraduate certificate. Your MSN, or even if you have a doctorate, you have to still have you have to be an advanced practice nurse in one of these specialties. Because what we're calling a postgraduate certificate means that there's some coursework that you do not have to do. In order to not have to do those and then still qualify to take a certification exam in a new field, you have to have had the coursework somewhere. And that would mean that you had it in a previous advanced practice nursing role. So one of these roles. We know that you have big dreams. You have great ideas. You have a vision in mind of what you want to do. We work great in teams, and look at this great team here. Look at these folks that are on mission. So we want you to surround yourself with people who you identify with, who work with you, who will work alongside you, and who you are moving toward the same mission. Here are the upcoming application deadlines. June 25th, if you're wanting to come into the fall term, which starts October the 6th. September 24th, if you're wanting to come into coursework in January. The application steps, you first fill out an online application. It includes an essay. You send a resume. Your transcripts will have to come, and you will send us a portfolio if you don't have a BSN, but you think that you should qualify for if your bachelor's degree is in something else. So that portfolio is, and we will give you guidance for that. That portfolio is really showing like your nursing experience, showing that you understand some of the concepts that are done in a BSN program. And then here's our current tuition. Once you get into clinical, you have to do a minimum of 750 clinical hours for a master's degree and a minimum of 16 weeks. For a PGC, it's also, that's the postgraduate certificate, 750 clinical hours, and it does have a minimum of 14 weeks instead of 16 weeks, but I will tell you that most people take about 6 to 9 months in clinical. That's the norm. And then the doctoral program requires 500 clinical hours. Midwifery and women's health, there are certain clinical requirements that there's a certain number of visit types. So you might have to do X number of new OB visits, X number of gynecologic visits, X number of menopausal visits if you're in the women's health, X number of births or newborn exams if you're in midwifery. So there are a certain number of visit types. It's not just clock the hours and you're done. You have to have accomplished the visits and demonstrated competency, which your preceptor and your regional clinical faculty are the folks that are making those determinations. This is our Versailles campus in Versailles, Kentucky, and we welcome students there frequently. We have Frontier Bound, which is that orientation every term, and we have Clinical Bound, which is that time of learning clinical skills every single term. So multiple times each term do we welcome students there and welcome them back for the second part of their educational journey. Okay. So I'm going to see if you have any questions about life as a midwife specifically, and then I'm going to go through the questions that are in the chat if there's some that have not yet been answered. Just life as a midwife. Is anybody like, I don't know if I want to be a midwife or not. Maybe I do, maybe I don't.
I have a question.
Okay, Camille.
So what is the scheduling like? I have one of my sisters is pregnant and I talked to her midwife And she says that she works 40 hours a week, that's inpatient and outpatient, and she doesn't have an on-call schedule. I don't know how realistic that is, or if it's because she's been a midwife for so long and it goes according to seniority.
It is different from place to place to place, Camille. I'll tell you that I know of some practices in very busy urban areas that the midwives work literally 12-hour shifts. That is uncommon. That is not the most common model. Other models, if there are 3 or 4 midwives in practice together, maybe you're in office 2 days and on call 1 day and 1 week in a month. Or if you're a single midwife in practice, you might be on call 24 hours a day, 7 days a week. If you have your own practice, in those situations, it's generally that let's say it was 24/7, it's going to be small volume. So you might not be going out to many births every week, but you're on call all the time because you don't have a partner. So you have a lot of flexibility when you start to job search. And I would say that's one of the things you're going to think about is what is going to work for me, what is going to work for my family, and what is available in this particular community. That didn't help as much as you had hoped, Camille, did it? But I hope it helped enough to let you know there's lots of options, lots and lots.
Okay, thank you.
Any other questions about life as a midwife or as a student or as a nurse practitioner? I've done both. I've done both together. I've done both separately.
I have a question.
Okay.
Hi. So have you, since you have both, I guess, degrees or certifications, have you been able to have a women's health NP job using just the CNM, or did you get them both before you started?
No, I didn't. I had the midwifery first, and I practiced as a midwife. So when you say that, are you saying meaning a job that doesn't have call? Is it possible to get a midwife job without call? Is that what you're really asking?
Well, no, like if someone is hiring for a women's health NP, but I only have the midwifery degree, would I be like qualified for that too?
It depends on the practice. Would the scope of practice, meaning what legally you could do in practice, be adequate for that? Yes, it would, unless they were wanting you to take care of males too, because the scope of practice for a WHNP also includes reproductive health for men. And so let's say you were wanted to work at a infertility clinic. You, as a certified nurse midwife, that's not within your scope of practice. Everything else would be in infertility, but not reproductive care for men. Does that help you a little bit? Most jobs, yes, you would be completely qualified to do any of it, most of them. In fact, the reason that people hire midwives instead of WHMPs is they can do all of that, plus they can do the births. However, that gap would be that male health if it's somewhere that needs somebody to do male reproductive health. Okay, does that answer your question?
Yes, it does. Thank you so much.
You're welcome.
Tanya, it's Ava. I'm
Yes.
going to read a question in the chat out loud for you to
Okay.
answer. Someone asked, what is the work-life balance as a CNEP student?
This is what I would say. It is a lot about how you create it, meaning the number of hours of study time per week for a full-time student. So if you took, and that's 3 courses for us, 2 to 3 courses is considered full-time for financial aid purposes, and it is considered full-time for the university because we're in those shortened 11-week terms. So it's kind of like you get the semester hours that are in a quicker time period. So for that student, around 40 hours a week of study time is needed. So that student would need to look at their life schedule and say, can I do 40 hours a week? If not, maybe I need to go to the part-time schedule, and that's fine. Or maybe I need to work part-time. Or for the student who doesn't have work or works part-time already, maybe that is doable. So it's very much individual as far as what you have in your life, how many kids you have. Do you have older parents that you're looking after or anybody else that you're having to look after? If so, you would want to consider that in making your choices about doing full or part-time. Does that answer your question, whoever asked that?
Yes, it did answer their question.
Right.
I have
Okay.
a question about financial aid.
Okay.
I it looks like part-time in the beginning for the midwifery program is only 3 credits.
Yes.
Is that true? Does that so when you read a lot about when you have to start paying back some of your loans, it
Right.
says you have to take at least 6 credits at a time to not have to start paying your loans back. Do you know anything about that?
Kelsey, first I'm going to ask if there's a financial aid officer on the call. Sometimes there is. No, Kelsey, I do not want to tell you. Oh, is there?
I said there is not. Sorry.
Okay. Oh, you got me so excited. I tell you that I have not heard of this being a problem. That 6 hours maybe, and is it saying 6 hours of graduate credit or 6 hours period?
Well, it's confusing because when you read, sometimes it says 6 hours or considered part-time at your program. So,
Right, and you would be considered part-time at our program,
okay.
but I think Ava put in the email for financial aid. I don't want to give you wrong information, and they are happy to answer those questions, but I don't think it's been a problem, so I think it's fine. But, pretend I didn't say anything aloud.
Okay, thank you. And then my other question was, well, about like midwifery versus women's healthcare. If you changed your mind in like the process of getting your education, does that affect things? Like, how long do you have to change your mind?
Well, I mean, theoretically, you could change it at any point. However, would it affect things? Yes, because there might be coursework either way that you have to go back and get in order to continue and complete that degree. But
Okay.
yes, you have the option of changing your mind.
Okay, thank you.
Hi, I have 2 questions. The first one is, if you're not sure if you want to be part-time or full-time, and you kind of want to get your feet wet, do you think you should do full-time and then change to part-time, or should you just start part-time and see how you're managing and then scale up? I asked the financial aid, I think I asked my counselor about that, and she said that you don't like to see people switching back and forth, but that switching is, of course, allowed if you need to do that.
Let me tell you the reason that I would say it's problematic if you switch back and forth multiple times. At some point, you're going to hit a point that you haven't taken a prereq for something. So you got to take X before you can do the next thing or whatever. Does that make sense? So we don't want you to get back yourself into a corner with going back and forth. But I would say, and we talk a lot about this in orientation, and you don't have to make this decision until you're registering for coursework, which you do at orientation. I would say there is a period of time at the very beginning of the term and that you can drop a course with doesn't hurt you at all. Like you're not going to get charged for it. It's only a week, but that week gives you time to lay out like all of the coursework, all of the readings, all of the assignments to say, I think I can handle this. And if so, great, move forward. And then if you need to back down, do. Like if you're leaning toward thinking you need to be part-time, I would advise just starting with that. But if you're like, no, I really think I can do full-time, I just don't want to regret it,
Okay. And financial aid is, you might have said this already, is financial aid available for part-time?
It is.
Okay. Now, the second question I have is I came to this workshop 2 years ago, and I believe at that time you had like a pathway to continue on to the DMP program. And when I spoke to council recently, they said that has phased out.
That's correct. However, you still can continue in
yeah.
that you just re-enroll and do the doctoral program.
So my question,
go ahead, I'm sorry.
That's okay. My question is, I'm in the position that like I'm looking at letters of recommendation that are required for the DMP program, and some of my former like directors of nursing are like retiring or getting ready to travel. And I'm wondering, even though I'm not ready to apply to the DNP program, should I be gathering that kind of stuff now just in case I can't reach them?
I wouldn't. And the reason I say that is you are going to finish, let's say you're going to do midwifery women's health. You're going to finish that and you're going to be working probably before you come back to your doctor. So you're going to have new relationships that are going to speak more to your role as an advanced practice nurse, which is more what we're looking for.
Okay, thank you.
That makes sense?
Yep, thank you so
Okay.
much.
Yeah, I'm
a
gonna
quick
keep reading
question.
some. Oh, go ahead.
I'm so sorry.
No, go ahead.
I'm sorry if this was already answered. My computer is
Okay.
always in and out. I saw on the website that if you do the the midwife program, you can add a postgrad certificate and be also a women's health women's health nurse practitioner. Is that still true? You can do a dual certification?
Well, it's not really a dual certification. It's two certifications that you did at two different times, one and then the other. So is it dual just meaning two? Yes. Is it dual meaning going together? No. But you can actually add on any of the other certifications. So let's say you do midwifery and you finish it and you think, I want to do women's health, then you can do so you don't have to retake courses that you've already taken. We would make a specialized program for you to take the coursework that you've not yet taken and do the clinical work for that particular program, and then you can sit for certification. But you could also do that for midwifery and FNP or psych mental health NP. So it's like just you choose what you're going to do first, and then you move through additional certifications if you want to do that without having to retake coursework that you've already taken.
Got it. Thank you so much.
To piggy off of what she was saying, how much of the coursework overlaps between the midwife program and the women's health nurse practitioner program? If we were interested in doing that.
Quite a bit.
Okay.
Because if you think about it, the roles are very similar. Now, there are some differences, but the roles have enough overlap as far as you got to know how to look after a pregnant person. You got to know how to do gynecologic exams. You've got to know how to, a lot of it is the same. So those courses are taken together. Midwives and women's health nurse practitioner students take a good number of those courses together. But then there's some division along the way. WHNPs do not do births, so they don't have to take intrapartum care. They do not do newborn care, so they don't have to do newborn. So so yes, there is a lot of overlap. So if you did midwifery and then you were going to come back and do women's health, you would not retake those courses that you had already taken. You would fill in the gaps of the ones that you had not.
Okay.
Or vice versa.
Okay, thank you. That makes sense. And so then at the end, you would just graduate with both certifications, but it would be a Master's of Science in Nursing. Is that correct?
You would graduate with one Master's of Science in Nursing in whatever. Then you would apply and re-enroll in whatever next thing you wanted to do as a postgraduate certificate in whatever.
Okay, gotcha. Thank you.
I have a question that might be more specific to, talking to a counselor, but I understand that there needs to be a portfolio submitted if you do not have a BSN, that have a bachelor's in something else. Is the portfolio meant to reflect only nursing specific experience, or can it also be related to experiences and things from your previous bachelor's degree and doula work, birth educator?
It's really not
birth educator.
I may have not said it very clearly before.
Okay.
It's really looking at nursing concepts that are covered in it. So it might be that you might have a question about leadership or about research. So some of those concepts that are covered in the BSN program and not the ADN program.
Yes, but it could be leadership that's not directly related to
and it's not necessarily
nursing.
what you're saying my experience is. You may be asked about more theoretical conceptual
Okay.
questions.
Okay, that makes sense. Thank you.
Because your experience, like your work experience, is going to be on your resume.
Yes, but this is more
Conceptual.
nuanced.
It's a little bit more conceptual. Yeah.
Okay. Is there more guidance available on that? Available on the website?
Ask your. I'm not sure that there is, so I would say ask
Oh,
your
okay.
counselor.
Okay, thank you.
Other questions?
I have a question. How are your classes formatted? I understand it's online, but is it pre-recorded lectures, or would we be sitting for like a Zoom lecture like we are now? I was just wondering how that would go about.
Okay. By and large, the coursework is asynchronous, meaning you're not going to have to be in a classroom every Tuesday at 10 o'clock or whatever. However, each course is different, and it may be that in this course that you have to sign up to be time and place specific for such and such assignment, or for a chat together, or for a discussion about so-and-so. But the signups for those kind of things would be immediately available at the beginning of the course, and they would be later in the course so that you have plenty of time to work your life around it. Most, I would say 90+% of the coursework is asynchronous though, so you do not have to worry about a specific time and place. Additionally, there is often, a lot of the courses have pre-recorded lectures in them, yes, but also offer maybe once a week lecture if you want to come in person, and then it's recorded and put out.
Okay, thank you. I also have one other question. I see in the group chat people are asking about like working at where you or doing your clinicals where you work, but you can't do that if you're in that department. Do you consider like mother baby being different than labor and delivery? Or like I know at my hospital we are all one department.
Right.
I was just
I
seeing
would
like
say it
what
depends on the size of the hospital. And the reason I say that is the hospital that I'm currently working in, for example, as a nurse midwife. If I looked after you today in labor and delivery as a nurse, I might have to, or as a student midwife, I might have to be assigned you tomorrow on postpartum. The bottom line is you need to not have a crossover of your role. So you don't need to see a patient today in one role as their nurse midwife, their student nurse midwife, and tomorrow as their RN at the same place. So generally we ask people to be moved to a different department. Now, a NICU might be different because that is a little bit more remote to the labor and delivery, as far as those are clients you probably wouldn't have looked after, et cetera, et cetera. And we work with you on that. We try to help you form a plan that works. A lot of times people will just take a leave of absence while they're in clinical from, say, if they work labor and delivery. They'll take a leave of absence from labor and delivery and either bank their time and get ready to go into clinical, or maybe go work in another unit in the hospital.
Hi, can you talk about the differences between clinical 1, 2, and 3? I think I saw that on the program of study. And is it 3 different clinical sites that we're going to?
No, not necessarily. It really is just about the progression of your hours that you're accomplishing, your hours and your visit types, as well as your competencies. So I'm going to make this up. Okay. Let's say clinical 1, because it's not 250, 250, 250. Let's say clinical 1 is X number of hours, but we expect that at the end of that time, you should be able to accomplish these competencies. You should be able to show this kind of level of thinking and of care. So then once you've accomplished the minimum number of hours within that clinical 1 and the competencies, then you can move to the next one. And so it's about scaffolding the competency and your experience in a way that is meaningful. Does that help?
That is helpful. Do you recommend like 2 different clinical sites, or doing it all in one?
What I recommend is finding what works for you as far as finding enough that you get the kind of time, the kind of experience, the number of whatever, whether you're a women's health nurse practitioner, that they do enough GYN, if it's midwifery, that they do enough births. And I would say that it's unusual, not that there's anything wrong with it, but it's unusual that a student has only one clinical site and one preceptor. That's unusual to be able to get everything that they need. But there would be nothing wrong with it. But if you think about what all do I need to learn and how can I best put that together, your regional clinical faculty and your clinical advisors can help you with that, especially your regional clinical faculty. When you talk to them about the kind of practice that you're probably going to, they can say, well, do they really do enough GYN? Because if they do that many births there, are they doing enough GYN or primary care to get what you need? Maybe you need to look at another site for that.
Thank you.
You're welcome.
How many births do you need as a midwifery student?
Minimum of 40.
Okay.
And you can imagine, Kelsey, that 40 births, there's some practices, 40 births you could get, in a few months. Then there are other practices like a home out of hospital setting or just a very rural area. It may take multiple months to get those births.
I had another question, or a question about the portfolio process, possibly. Maybe like what's the best recommended route? I currently have a bachelor's in another field. I have like 10 years of experience as a doula, and I'm interested in becoming a midwife. Is it like most recommended to just go get the BSN, or to do like just an RN, like ADN, RN degree?
If
and
you've
then
already
try
got a bachelor's,
portfolio?
do whatever's going to get you done the fastest.
That's kind of how I'm feeling. Yeah, I'm really torn between wanting to do it well and thoroughly, and just I love midwifery. I
It
know
won't make any difference because
okay.
your experience as a nurse is going to give you those other pieces that are needed. And you may have taken a leadership or a research class in your bachelor's. I mean, so you may have those concepts, those ideas, and you're certainly going to get it in your work.
I guess somewhere is the portfolio process, is that almost harder? Like, is it a more, is that like admissions have more scrutiny, than like
No, I don't think so.
Okay. So just kind of, if I know like midwifery is kind of my path, just focus perhaps on the time. And then I had, okay, that's helpful. I might kind of think about this differently. And then I had a question too about, placements. Like how closely does Frontier kind of watch clinicals with regard to like the midwives being able to practice their full scope? I know, of course, as a doula, I've seen a lot of different things, and I think some midwives, in different settings aren't always allowed to fully be a midwife. So do you guys have sort of ways people can kind of make sure that midwife is?
No, not yes and no. We do get feedback from students. So in that case, there may be notes in our clinical app, but we know that if once you get into a site, if you're not getting what you need, then we help you look for another site.
Sure.
And you may know it going in. You may say not going to get enough X or Y, or they're not able to do enough so and so. So let's seek an additional experience for you.
Okay, awesome, cool. Thank you.
You're welcome.
I have a quick question.
Okay.
Can you hear me?
I can. Yes, I'm sorry.
Okay, sorry. No, I'm sorry. Okay, so this is a little more of a specific question. If you're not able to answer it, it's totally well. I actually am looking into re-enrolling, like reapplying and everything. I started actually a couple years ago, and then life happened. So I needed to take a little bit of a leave of absence, but I have a specific question about a course. The role of the midwife course, does that also like translate over to the Women's Health NP course? It's like the same time frame, or you would have to take the Women's Health NP course?
You have to take the NP role course. It is very different because the licensure is different. It's a different role.
Okay, that. Thank you so much for clarifying.
As far as the kind of patients you see, it's very similar, but the role, like the professional organizations, all of those things are very different.
Okay, very good. And then I think it. I ask more specific course questions later on, but this as well. Thank you so much.
You're welcome. Ava, are there other questions that we missed?
I just saw this. Oh, go ahead. Sorry.
How does Frontier support their students towards graduation for sitting for their boards?
Before graduation or after?
Before and after.
Okay. So before, we have a comprehensive exam certification review course. In fact, I teach the women's health one. It's only a 1 credit hour course, but it's meant to be a time to help review content, prepare you for your certification exam. And we talk a lot about the certification exam within those courses. So there's one for every specialty. So there's one for midwifery, there's one for women's health, etc. And then you go take your boards. And then I guess afterwards, I can't really picture, like if you've struggled, then we do want you to reach back out to us and we can help direct you toward some resources for that. Is that what you were asking? Did I answer the question you're asking?
Yes, you did. Thank you.
Okay. Sometimes, you're just talking away and it all sounds good, but it didn't have anything to do with what somebody asked. So please redirect me if I do that.
I saw this in the chat and I had the same question about doing clinicals with CPMs. I had a friend who graduated from Frontier. I know there's some restrictions on like out of hospital, like there's certain, there's
Right.
certain parts you couldn't do, but can you talk more about that?
Yes, you cannot do, your preceptor has to be a certified nurse midwife or a
Sure.
certified midwife,
Okay.
yes, not a certified professional midwife or a lay midwife, but it has to be a CNM or a CM for births or a physician. Okay.
Okay.
Or a combination thereof. And a certain good amount of it has to be with a CNM because that's what you're being educated to do. Did I answer all of your question, Victoria? Or was there another part to that?
Yes, I think that was, that
Okay.
kind of helps explain it. Yeah, for sure. Thank you.
Hi, can I ask how many clinical hours or what courses would following a physician OB for like how much of those credits towards the clinical hours would that
Okay.
be allotted?
Okay, you don't have to do any of it with a physician. You can do all of it with a nurse midwife or with a nurse practitioner. But I am not looking right at the numbers. I want to think has anybody got access enough to I don't want to give a wrong number, access to the catalog to give the maximum amount with a physician?
I'll look it up for you, Tanya. Give me
Okay,
just
thanks,
one moment.
Casey. Yeah, I just am not, I'm afraid if I move my screen, we're going to have a mess on my hands. I'm going to move slides just because I think we've answered this one and we may have, basically the bottom line is my other slides are just if you've got admissions questions, clinical placement questions, etc. So that we're answering those as we go, but just so you know, that's what was left in the slideshow.
So
And how to get in touch with us.
With a MD or DO, was that the question?
Yes.
Okay, so it's 20% of the total clinical hours.
Okay, thank you.
Okay.
And then a maximum of 8 births is what it says.
Thank you.
Okay. And another question I have a friend who's like currently in the program and in the state, or at least in Pennsylvania, has had problems finding clinical placement because a lot of the schools that are nearby have pretty much deemed like only their students can have clinicals at X, Y, and Z hospitals. So does Frontier kind of like help students find other places where they could find clinical placement?
Casey, do you want to answer that?
Well, you may already have an idea since you do have a friend that attends Frontier, but we do have what's called our community map. And that allows students to look in different areas to see what sites and preceptors have been used in the past or currently using from students. And that holds, I think it's like more than 18,000 preceptors and sites over the United States. So we do have that, and you have the clinical advisors as well to assist you and provide tips and resources to help you along through the clinical process as well.
I will say this too, and that is Do some students have to move or go outside of their immediate community? 100%. Because for different reasons, like when I came through school years ago, there was not a midwife close to me. The closest one was about 40 minutes away. And she initially accepted me, and then she decided she didn't want to do students at all, and she didn't do them for several years. So I ended up having to go about 3 hours away, closer to 4. And so I would go for a few days and stay and get time and births in, and then I'd come home for a few days. And I had 3 children. Now, was it easy? It was not. Was it worth it 100%? Yes, it was worth it. So it really, and sometimes what we'll say to somebody, if they're really having hard issues close to them, but you can see we have a lot of preceptors out there, is we say, okay, do you have a family member that lives somewhere that's maybe not as congested with students? Do you have a family member that lives in another place that you could go and stay with them? You do have to have an active RN license or a multi-state compact that covers the state of anywhere you would go as a student, just so you know. But sometimes people do that as an option, like if they absolutely cannot find something or something like they want, because sometimes that's the issue, then that is another option as well.
Okay, thank you so much.
You're welcome. Now, I don't even know how long this is supposed to go because I can talk all night about being a midwife or a nurse practitioner. I won't do
It
this
does go
now.
to 6, but we do have quite a few more questions if in the
Okay,
chat.
you want to throw them at me?
I'll throw them at you. Someone asked, I realize this is a range, but are you able to talk about money? On average, how much can a midwife make typically?
Oh gosh, it is such a range. I would hesitate to say. This is what I would advise you to do. Go to the CNM website and look for the latest salary study that has been done. That's going to be your best option, because otherwise I'm just making up dollars and cents.
Another question here is, what's the grade point average minimum for the classes?
Meaning actively in a class, or meaning to be admitted?
If anyone wants to come off mute and kind of elaborate.
In a class, you have to make a B. And the grades at Frontier are either A, B, or you didn't pass. And for a B for us is 80%. Sorry, I know that's not the same everywhere.
Can I ask one more question?
Certainly.
What would you say, like your, I don't know, maybe like your best advice, or what advice would you give, or how would you advise someone who's thinking like, or torn between pursuing the CNM or the women's health NP route?
Yes, this is what I would say. I think it almost boils down to one question. How important is being able to do births to you? Like if you don't see yourself doing births, you don't really care that much about it, you like it, but maybe you don't want to do it, then do the WHNP, because the time and the hours of call during the clinical placement time, etc., it's a lot. And getting your births done is probably the most challenging piece of it and the stress of it. But if that is your heart and soul, then you need to be a midwife. And there's no judgment either way. Like, I'll tell you, at different seasons in my life, I would have had different answers for that. But that's what I would say. Because that's the biggest thing that makes the biggest difference as far as the educational process and the work process.
Thank you.
Abby, you got other questions for me?
I
Is
do.
there, oh, I'm sorry.
No, go ahead. You can go ahead.
I was gonna ask, is there a certain amount of students you guys accept per term?
We do have guidelines for each program as far as how many we anticipate accepting. I don't have those admission. Does somebody have those admission? We accept around. Okay, how about I do that? That way it's not cut in stone. We admit around between 80 and 100 midwives each term. That doesn't mean that there are 80 midwives at your orientation, because there's more than one orientation each term. But to start coursework, for example, in the next term, approximately 80 to 100, and anywhere from 25 to 50 WHNPs, depending on how we're rounding out the numbers and what the applications look like.
Thank you.
I have a question. What is your best advice for applying? Like, do you have any certain recommendations that really would make us stand out as a candidate?
This is a free tip. Okay. Here's my free tip. When you go to write your essay, make sure you're answering the question that is asked. Like, don't send a generic essay that you might have written for 25 schools. And I know we've all got one, and that's okay. You can start there. But then make sure that you answer what is asked in your essay prompts. And on your resume, make sure you put everything down. Even if it, in a work resume, one of the things is don't go past one page. I would say that's not true for this. If you go past one page a little bit, that's okay. Don't do 20 pages. Please don't do that to me. But a couple of 3 pages on a resume is fine. Like, if you need to do that to capture the essence of everything that you've done as a nurse, please do that.
Does it matter if you, like, I'm gonna use myself for an example. I started in labor and delivery. I was an extern for a year, and then COVID happened, and that kind of took that position away. And then I went back into labor and delivery like 2 years later. But now I'm not in labor and delivery. Does that matter a lot? Like, I've got the passion for it. I was reading some things online, and just a lot of what was being said kind of got inside of my head. So I wanted to ask if that is a big deal.
Okay, first off, it makes 0 difference as far as admissions. Okay, so let's start with that. But then as far as getting a preceptor, it's going to depend on the preceptor. Some preceptors are going to say they want somebody that has had labor and delivery experience. They're probably not going to care if it's this week or not. Like, if you've had it, you've had it. From a theoretical perspective from school, there are going to be other preceptors that don't care. Here's the thing. People become all sorts of things in the world and have not had that specific experience. That's what your education is about. There are many midwifery programs that they may not have any nursing experience at all. They go in as a non-nurse, go through, get their nursing, go through get their midwifery, and they have to have had a preceptor too. So it's are there things that, as a labor nurse, that you are going to know that are going to help you in clinical? 100% yes. Are those same things that a non-labor and delivery nurse can learn? Yes. Yes, yes, yes. Okay, I want you to watch the expression on my face as I say this. Many of you have precepted students, I'm going to say in labor and delivery, because that's what we're talking about right now. Some of those new nurses that come in, you didn't think they'd ever learn how to check a cervix, did you? But they did. You didn't think they'd ever learn how to read a strip, but they did. They are skills. They are skills that you can attain. Your learning curve might be a little steeper if you have not had that experience. But if you've had experience in a psych ward, boy, you're going to be heads and shoulders above when you get the patient in labor and delivery who needs more mental health support. So we all bring different things to the table, and you're going to highlight those when you talk to potential preceptors. You're going to highlight what your experience is and what you bring to the situation.
Thank you.
You're welcome.
I have a question real quick. How important, I was looking at the resume requirements or the format, how important is the volunteer experience portion of that as far as being accepted as an applicant?
I mean, if you've had it, put it on there, but it's not going to make or break you.
Okay, thank you.
I'm going to tell y'all this. I've been a midwife for, what year is it? I don't even know, 2025? I've been a midwife for 25 years. I would do it again, over and over and over, and twice on Sunday. I've never regretted the time, the effort, the money put in to become a nurse midwife and a women's healthcare nurse practitioner. It is the most beautiful work, most exciting work ever. Best job ever. Do we have other questions that we missed?
I have a question. So, I remember in nursing school, like we have some nursing programs around here that didn't, if someone were to not be successful in a course, you were kind of like, you only had one chance as far as taking the classes one time. And if you weren't successful, you were out of the program. How does that work at Frontier?
Sure. First off, the good news is we offer every course every term. So you don't like to have to sit out a year like you do in a lot of programs if you were to be unsuccessful in a course. Our current rules, for lack of a better word, are that you can't have two course failures, that you're out of the program at a second course failure.
Okay. And then my last question is, as far as, do you guys have, I know that you guys have like a link of where you could apply for scholarships, but does Frontier itself offer scholarships, whether it's like GPA, merit-based? Yeah.
Yes, that's that twice a year that we send out like a call or whatever. Anybody who wants to apply for the Frontier scholarships, here's what we have available this year, and here you can send your scholarship application in.
Okay.
That $1.7 million worth of scholarships offered through Frontier.
Oh, okay.
I hope I'm not lying. I'm 91% sure that's 89% sure that's correct.
Okay. Thank you.
I know we're coming on time. Do you have time to answer a couple more?
Yes, absolutely.
Okay. This was asked a little earlier. I think we missed it. They asked, did you say a WHNP can deliver? Is that true across the nation?
No, WHNPs, it's not within the scope of practice for WHNPs to do care during labor or to do the birth. So no, they cannot. Any other questions, Ava?
Scan in the chat to see if we missed anything. What is the liability as a nurse midwife like?
Well, it's very similar to the liability. Are you meaning like malpractice liability? Is that what you're asking? Yes. I'm assuming that, yes, that's what okay. I'm going to assume that's what we're asking. It is very similar to the liability for an any obstetric provider. So is there liability there? Yes, there is. Most employers pay the malpractice insurance for their employees. And you can negotiate that as part of your contract if you go in to a job where that's not currently being offered.
I see another question in the chat. I have an interest in helping women with perinatal mood disorders. I'm having a hard time deciding between WHNP and PMHNP. All my experiences in IND, PP, and nursery, and I have a bachelor's in psychology in addition to my BSN. Do you have any advice for me?
I cannot tell you that I know of any jobs that are specifically perinatal mental health. Is there that need? Yes. I would say probably it would be more likely that you could really focus on that in the psych mental health program. So when I said no jobs, I specifically meant in WHNP world or midwifery world. Could that be an important integral part of your practice? Yes, because I find that I have an interest in, pardon me, some of the same things. And so a lot of the patients that are kind of funneled my way are patients with concerns in those areas. However, it is not the bulk of my work at all. Does that help you? Whoever asked that.
They said yes, and thank you. Another question. Have you done any private or independent work as a CNM, or do you know anyone that has? If so, what was that process like?
I have, and I'm going to assume that you mean what I mean by this. I have done contract work as a nurse midwife, meaning a practice or a physician would contract with me to cover call for them or whatever. And I just established an LLC. They pay that LLC and taxes aren't taken out, and I'm responsible for all of that at the end of the year. Is that what you were asking?
Can I ask how much you charge for that? I know it's not all about the money, but it's a little bit about the money.
I'm sorry. I actually don't give that information out. I apologize. And you have to remember, I've got 25 years of experience.
Totally. I was just curious. I mean, I know that the locums doctors here at the hospital make a decent amount.
They make bank. It's nowhere near that.
Okay.
I wish. No.
They said no. I'm asking if you do births like at home or on your own.
Okay. No, I do not do home births, but there are lots of midwives that do home births, and yes, they own their own practices and they do prenatal care either in the home of the client or in their own home. Sometimes they'll have them come in for prenatal care and they do births. So yes, that is done. That's done, yes. But have I personally done it? No.
Someone asks, I am currently a CPM. Can I work as a CPM during the program?
You cannot. You cannot work as a CPM during any of our programs. Because here's why. I don't want to act like I'm throwing down on CPMs. I'm not. The work of CPMs is wonderful. Here's the thing. Our malpractice insurance for the university covers you from the time you're enrolled in the school. Our malpractice carrier will not, because you can't unknow what you know. If you're there at a birth, you still are a midwifery student, and so you're still our responsibility. And in the big, bad, ugly malpractice world that we live in, the deep pocket is who people would be going after if there were an unfortunate outcome. And in that case, it would be the university. So one of our rules is that you cannot work as a midwife of any sort. I don't know the name of the actual malpractice carrier. I'm sorry. But I know that piece of information.
Someone asks, is it within a CNM scope to deliver via home births, or is it more state specific?
It is within the scope of practice. State to state vary on their rules, but I don't know of any state that says you cannot do home births. But so when you think about scope of practice up here on the biggest umbrella is what do we educate you to be able to do? What does our professional organization say is your scope of practice? Then within that, your state may have more constrictive scope of practice and say, no, actually you can only do this in this state. And then if you work for an employee, it's usually even smaller. Just meaning at a particular hospital or particular clinic, here's what we say you can do.
Is it possible to take 3 courses some terms if all the prerequisites are met?
Yes, it is.
I have a question. In regards to the deadline of the application, what's normally the turnaround time before you find out if you were to be accepted into the program?
I'm being quiet because I do not know. Is there anybody on the call that does know?
Yes, hello. This is Richard from admissions. On
I
average,
see you were quiet till now, not willing to jump in.
yeah,
Mhm.
I'm trying to keep up with the chat. A lot of great questions coming in.
Thank you,
But,
Richard.
no problem. So from the time of submitting all the documents, it's on average about 5 weeks turnaround time to be updated on your application status. So from the submission, on average about 5 weeks. And if anybody has questions, I guess while I chime in here, if anybody has questions for admissions, definitely contact us at 859-279-0890. I posted that in the chat, and then the email for admissions. It's fnuadmissions@frontier.edu.
What are your normal hours? When would we get the
We're
call?
in the office, so geez, from about 9 a.m. Eastern to 7:30, Monday through Friday.
Thank you.
Yeah, you're welcome.
Really quick, someone asked, they said they're sorry if they missed this, but is housing provided during Frontier or clinical bound weeks?
We do have housing on campus, and so it's part of the fee, yes. So yes, there's housing. And we'd love for you to stay with us on campus because that gives us a chance to like just kind of be all together. Frontier.edu. If you have more questions, go there. And I'm happy for you to email me. You can email admissions, you can email financial aid, you can email Casey. How's y'all's listed?
Ava put it in the chat box, so it's
good.
in there,
Look at
clinical
Ava.
advising at frontier.edu.
Well, she's got it all right, and I probably got it all wrong. So, are there any other pressing questions? I don't want to get off this call if you have a pressing question. I want you to have it answered.
I had a question about clinical sites. So I saw that we need to have at least one inpatient or hospital setting and one outpatient clinic. So would inpatient include, so I'm thinking specifically of a birth center that I know. So like part of the building is for daily like clinic visits and part of it is for people that are admitted in labor. Does that
You would
count?
also have to have a hospital inpatient because
Hospital.
birth center is considered community birth, not hospital birth. The reason being, you need part of your skills and your education has to be that you're able to manage and understand a little bit higher, moderate and higher risk, things that would not be appropriate in birth center. So you have to also have some experience in the, I'm gonna call it inpatient hospital type setting.
Okay, and is there like a certain amount or minimum amount of like births and hours? Like, so say like I got most of my experience at the birth center and like I spent one clinical semester at a hospital, and so I had less
It's a
experience there.
number of births, if I'm not mistaken. Casey, do you have that up in the catalog?
I know you said 40.
I'm sorry, what was the question? I was responding to
Is
somebody in
there
the
a
chat.
certain number of births? There is, and I've got a number in my head, but I don't want to say it out loud. A certain number of births that have to be done inpatient in a hospital. So for somebody who's doing mostly community birth.
I'm not sure if that's listed in the catalog. I do know that it just says for like if you're doing a preceptor is a MD or DO, it's 8 births. That's I'm not sure if the other information is in there. I've never had that question asked, so that's a good question.
I'll tell you what, was that Kelly that asked that?
Yes. Yep.
Kelly, you can email Eva Fried, Eva, EVA.FRIED. It looks like fried, but it's pronounced Fried at frontier.edu and ask her that. She's the current clinical director.
Okay, thank you.
Well, I think we've come to the end of this journey. I'm so glad we had this time together. Y'all are all too young. You don't even know what I'm referencing there. Look up Carol Burnett. That's what she used to do at the end of all her shows. Thank you for being here this evening. I hope you are excited. That's what I wanted you to get from this, is some information, but also maybe some excitement burning into you to want to be a midwife or a women's healthcare nurse practitioner and to want to be a Frontier graduate. We hope that you're applying. We hope to see you at Frontier Bound. And yay!